What are the key considerations when designing an enclosure for a species with specific social behavior requirements, such as primates? Explain how environmental enrichment can address these needs. Answer: when designing enclosures for species with specific social behavior needs, such as primates, several key considerations must be taken into account. Social structure. Primates are highly social animals, and enclosures should be designed to accommodate their social groups. Sufficient space and multiple areas for different groups may be necessary to prevent aggression or stress due to overcrowding. Enclosure size. The enclosure must be large enough to allow for a range of natural behaviors, including climbing, foraging, and social interaction. Complexity and vertical space. Primates are arboreal or semi-arboreal, and therefore vertical structures like ropes, platforms, and branches should be integrated into the enclosure design. Environmental enrichment. Enrichment strategies are crucial to prevent boredom and enhance the welfare of primates. These can include puzzle feeders, movable objects to manipulate, and varying sensory stimuli such as sounds and smells. Providing opportunities for exploration and natural behaviors will help maintain their mental and physical health. Explain the physiological and psychological factors that influence animal behavior during handling and restraint. How can an animal handler minimize stress for an animal during the restraint process? Answer: handling and restraint of animals can lead to both physiological and psychological stress influenced by factors such as fear response. Animals, especially prey species, exhibit a natural flight or fight response when threatened. Increased heart rate, raised blood pressure, and the release of stress hormones like cortisol are common physiological reactions. Body language and communication. Animals often communicate discomfort or anxiety through body language. For instance, a dog may show signs of submission or aggression, while a cat may hiss or arch its back. Understanding these signals helps minimize distress. Previous experiences. An animal's past experiences with handling will influence how it reacts. Animals with positive past handling may be more calm and cooperative, whereas animals that have experienced painful or improper handling may react aggressively or fearfully. To minimize stress during restraint, pre-restraint preparation. Ensure the animal is calm before handling by creating a quiet, familiar environment. Use of proper restraint equipment. Always use the appropriate restraint tools such as muzzles, leashes, or restraint collars for the species being handled. Gradual desensitization. Animals can be gradually desensitized to handling through positive reinforcement, making them less fearful over time. Proper technique. Handling techniques should be firm yet gentle with consideration of the animal's anatomy and comfort. For example, when handling a dog, one should avoid pulling on sensitive areas like the neck or tail. Relevant guidelines, regulations. The Australian Animal Welfare Standards and Guidelines for the Care and Use of Animals emphasize the need to minimize pain and distress during handling, aligning with the Prevention of Cruelty to Animals Act 1986. Mr. Roberts is responsible for managing the care of a group of reptiles in an educational facility. Recently, he noticed that one of the reptiles, the bearded dragon, is spending more time hiding and refusing food. Mr. Roberts has ensured that the enclosure is clean, but the temperature control system seems to be malfunctioning. What should Mr. Roberts do to resolve this issue and improve the animal's well-being? Answer: in this situation, Mr. Roberts should first address the potential issue with the temperature control system. Bearded dragons, like many reptiles, are ectothermic and require precise temperature gradient in their enclosure to regulate their body temperature. A malfunctioning temperature control system can cause stress, decrease appetite, and lead to lethargy or illness. Steps to resolve the issue. Immediate temperature assessment. Mr. Roberts should use a thermometer to assess the current temperature in both the basking and cooler areas of the enclosure. The basking spot should be around 3540 95104, while the cooler end should range from 2228 7282. Fix the temperature control system. If the malfunction cannot be immediately fixed, Mr. Roberts should consider using temporary heat sources like a heat lamp or ceramic heat emitter to maintain the correct temperature. Provide additional environmental enrichment. Ensure that the enclosure has proper hiding places, climbing structures, and visual barriers, which will help reduce stress and encourage normal behavior. Monitor the animal. After adjusting the temperature, Mr. Roberts should monitor the bearded dragon closely for signs of improvement, such as increased activity and appetite. What are the core principles of designing an animal enclosure to ensure it is both safe and enriching? Answer: designing an animal enclosure requires a balance between safety and enrichment. The following principles should guide the design. Species-specific requirements. Each species has unique needs. For instance, an enclosure for a nocturnal animal like a hedgehog should offer low lighting and burrowing options, while an active species like a meerkat needs plenty of vertical and horizontal space. Safety and security. The structure must be secure to prevent escape and protect the animal from potential harm. It should also minimize the risk of injury with smooth surfaces, no sharp edges, and secure doors or latches. Environmental enrichment. The design should include features that stimulate the animal's physical and mental health. These might include climbing opportunities, hiding places, and interactive toys or puzzle feeders. Comfort and shelter. The enclosure should provide areas for rest and shelter away from disturbances and extreme environmental conditions. It should also allow for natural behaviors such as foraging, grooming, and social interactions. Accessibility for care. The enclosure should allow for easy cleaning and maintenance with removable panels or doors to access all parts of the habitat. Explain the role of ventilation and air quality control in animal enclosures. How can improper ventilation affect the health of the animals? Answer. Ventilation and air quality are crucial for maintaining the health and well-being of animals in enclosures. Proper ventilation helps to remove harmful gases. Inadequate ventilation can lead to a buildup of ammonia, carbon dioxide, and other harmful gases, which can irritate respiratory systems and lead to conditions like respiratory infections. Maintain proper humidity. Certain species, such as amphibians, require a specific level of humidity for optimal health. Insufficient airflow can prevent moisture from escaping, creating a stale environment that can promote the growth of mold or bacteria. Prevent heat stress. Poor ventilation can cause the enclosure to overheat, particularly in tropical or desert species. Overheating can lead to stress, dehydration, and even death. Health implications of improper ventilation. Respiratory issues. Insufficient oxygen and the accumulation of carbon dioxide can cause breathing difficulties. Thermal stress. Poor airflow can result in uneven temperatures, leading to overheating or hypothermia depending on the species. Mold and bacteria growth. A lack of air circulation increases the risk of bacterial and fungal growth, which can cause infections and disease. Relevant guidelines, regulations. The Australian Animal Welfare Standards for companion animals specify that enclosures must have proper ventilation to ensure a healthy environment, particularly for species that are sensitive to temperature and humidity. Describe how temperature control affects the physiological processes of ectothermic animals in captivity. What are the risks associated with incorrect temperature regulation in their enclosures? Answer. Ectothermic animals, such as reptiles and amphibians, rely on external environmental conditions to regulate their body temperature. Proper temperature control in their enclosures is vital because metabolism regulation. Ectotherms do not produce their own body heat. If the enclosure is too cold, their metabolism slows down, impairing digestion, activity levels, and immune function. Behavioral impact. Temperature affects behavior, including feeding, breeding, and overall activity. A reptile kept in an environment too cold may refuse food, become lethargic, or experience health issues like digestive problems. Thermoregulation. Ectotherms need a temperature gradient in their enclosure, allowing them to move to different areas to warm up or cool down as necessary. Incorrect temperature regulation can prevent them from thermoregulating, leading to stress or illness. Risks of incorrect temperature regulation. Hypothermia or hypothermia. Exposure to temperatures outside their optimal range can lead to metabolic shutdown or organ damage. Immunosuppression. A cold environment can lower the animal's immunity, making them more susceptible to infections. Feeding problems. A cold enclosure may result in a lack of appetite and digestive issues. Relevant guidelines, regulations. The Australian Code of Practice for the Care and Use of Animals for Scientific Purposes stresses the need to maintain optimal temperature conditions for ectothermic species to ensure proper physiological functioning. What factors should be considered when creating an enclosure for nocturnal species, and why are these considerations important? Answer. Creating an enclosure for nocturnal species requires special attention to several factors. Lighting. Nocturnal species are adapted to low-light environments. Bright lighting can cause stress and disrupt their natural circadian rhythms. Enclosures should be equipped with dim or indirect lighting or read infrared lights that do not disturb their sleep cycles. Temperature. Nocturnal species often seek cooler environments at night. Temperature gradients should be provided to allow the animal to choose its preferred temperature, typically cooler than what is required for diurnal animals' hiding places. These species typically feel more secure when they have dark, concealed areas to rest during the day. A variety of hiding spots within the enclosure helps mimic their natural nocturnal behaviors. Sound and smell. Nocturnal species are often more sensitive to sound and smell. The enclosure should minimize noise disruptions and provide opportunities for sensory enrichment like scent or objects that stimulate natural foraging behaviors. How does the maintenance of an animal enclosure contribute to the health and well-being of animals, and what are the key elements to focus on during regular cleaning? Answer. Proper maintenance and cleaning of animal enclosures are essential for preventing disease and maintaining the physical and mental health of the animals. Key elements to focus on include removal of waste. Feces and urine can harbor bacteria and parasites. Regular cleaning is essential to prevent the buildup of harmful pathogens. Disinfection. Enclosures should be disinfected periodically to eliminate potential sources of infection. However, the cleaning agents used must be safe for the species in the enclosure, replacing bedding or substrate. For species that require bedding, e.g., reptiles, small mammals, replacing soiled substrate is vital to prevent odors, infections, and the spread of parasites. Check for wear and tear. Regular inspections should be conducted to identify any damage to the enclosure that could pose a risk to the animals. Relevant guidelines, regulations. The Australian Animal Welfare Standards emphasize hygiene and cleanliness to minimize the risk of disease transmission and promote the health of captive animals. What are the ethical considerations surrounding the use of restraint on animals, particularly when it comes to minimizing distress and ensuring the well-being of the animal? Answer: when using restraint on animals, ethical considerations are crucial to ensure the animal's welfare. Minimizing distress. Restraint should only be used when absolutely necessary, and the animal should be carefully monitored to prevent undue stress. Use of proper restraint equipment. Restraint devices should be appropriate for the species, used correctly, and ensure that the animal's physiological needs, such as breathing and circulation, are not compromised. Animal welfare. Any restraint technique should prioritize the animal's well-being, ensuring that it does not cause pain, fear, or long-term harm. Relevant guidelines, regulations. The Animal Welfare Act and the Australian Animal Welfare Standards highlight that the use of restraint must always be done in a manner that minimizes discomfort and distress, ensuring that any intervention is humane and justified. What is the significance of proper enclosure design for preventing disease transmission in group-housed species, and how can this be achieved? Answer: proper enclosure design is crucial for minimizing the risk of disease transmission in group-housed species. Key strategies include separate areas for sick animals. Enclosures should be designed with the ability to separate ill animals from healthy ones to prevent cross-contamination. Effective ventilation. Proper airflow can reduce the spread of airborne pathogens such as bacteria and viruses. Hygiene protocols. Group housing requires meticulous cleaning protocols to reduce the buildup of waste and pathogens that can spread disease. Space for social distancing. Overcrowding increases stress and the likelihood of disease transmission. Adequate space within the enclosure allows animals to maintain a healthy distance, reducing the chances of direct transmission. Relevant guidelines, regulations. The Australian Animal Welfare Standards stress the importance of disease prevention measures, particularly in group housing, including the importance of sanitation and space to ensure the health of all animals involved. Discuss the role of the nervous system in thermoregulation and how it contributes to maintaining homeostasis in animals. Answer: the nervous system plays a crucial role in thermoregulation by monitoring the body's internal temperature and initiating appropriate responses to maintain homeostasis. Thermoregulation is the process by which an animal maintains its body temperature within a certain range, which is essential for optimal metabolic function. The hypothalamus, part of the brain, acts as the central thermostat of the body. It detects changes in blood temperature and sends signals to effectors, e.g., sweat glands, blood vessels, muscles. If the body temperature rises above the optimal range, the hypothalamus triggers cooling mechanisms like vasodilation, expansion of blood vessels to increase heat loss through the skin, sweating to evaporate heat, and panting to increase heat dissipation. Conversely, if the temperature falls below the optimal range, the body conserves heat by triggering vasoconstriction, narrowing of blood vessels, shivering to generate heat through muscle contraction, and reducing sweating. This feedback loop, known as negative feedback, ensures the body remains at a stable internal temperature despite external temperature fluctuations, allowing physiological processes to continue efficiently. How can external parasites affect an animal's health, and how should they be managed in a veterinary practice? Answer: external parasites, such as fleas, ticks, and mites, can cause a range of health issues for animals, including skin irritation, blood loss, infections, and in severe cases, transmission of diseases, e.g., Lyme disease from ticks or tapeworms from fleas. The presence of external parasites can lead to discomfort, stress, and significant damage to the animal's skin, coat, and overall health if not properly managed. Management of external parasites involves a combination of preventive measures, identification, and appropriate treatment protocols. Preventive measures. Regular grooming and skin inspections to detect early signs of parasites. Use of preventive medications, e.g., topical treatments, oral medications to deter parasite infestation. Environmental control, such as cleaning bedding and living areas, as many parasites lay eggs in these locations. Identification and diagnosis. Veterinarians use diagnostic tools like skin scrapings, flea combs, or blood tests to confirm the type of external parasite affecting the animal. Treatment. Prescribed medications, such as topical insecticides or oral antiparasitics, effectively target and kill parasites. In cases of heavy infestation, systemic treatments, e.g., injections or oral medications, may be necessary. Legislation. Under the Animal Welfare Act and various state regulations, veterinarians are required to adhere to prescribed treatment protocols for parasitic infestations and to provide guidance on maintaining a clean and safe environment for the animal. Mr. Thompson works at a local animal shelter and has noticed several dogs showing symptoms of lethargy, loss of appetite, and coughing. He suspects they may have a respiratory infection. What steps should Mr. Thompson take to manage this situation effectively, considering both the health of the animals and legal requirements for disease control? Answer. Mr. Thompson should take the following steps to effectively manage the situation. Immediate isolation and identification. The dogs exhibiting symptoms should be isolated from other animals to prevent the potential spread of the infection. The shelter should designate a separate area for infected animals, with staff using personal protective equipment (PPE) such as gloves and masks when handling the animals. Veterinary assessment. Mr. Thompson should contact a veterinarian to perform a thorough examination of the affected dogs. The veterinarian may conduct tests, e.g., blood tests, chest x-rays, or cultures to identify the specific pathogen causing the respiratory infection. Common respiratory infections in dogs include kennel cough, Bordetella bronchiseptica, or canine influenza. Disease control and management. Treatment. Once diagnosed, the veterinarian will recommend a treatment plan. For bacterial infections, antibiotics may be prescribed, while viral infections may require supportive care, such as hydration, rest, and anti-inflammatory drugs. Vaccination protocols. Mr. Thompson should ensure that other animals in the shelter are up to date with vaccinations to reduce the risk of future infections. Monitoring and record keeping. He should monitor the dog's progress closely and keep detailed records of symptoms, treatments, and outcomes. This is crucial for tracking the health status and providing necessary reports. Compliance with animal welfare and health regulations. Under the Animal Welfare Act, Mr. Thompson is obligated to take all reasonable steps to protect the animals in his care. This includes notifying relevant authorities if the disease is contagious or requires special handling under veterinary guidelines. Prevention and future planning, cleaning and sanitation. Mr. Thompson should ensure that the infected areas are properly disinfected to prevent cross-contamination. Public education. In cases where the infection is known to be communicable, e.g., kennel cough, Mr. Thompson should inform pet owners who bring animals to the shelter about potential risks. Describe the physiological processes involved in digestion and how the digestive system maintains nutrient absorption in animals. Answer. The digestive system is responsible for breaking down food into smaller molecules that can be absorbed into the bloodstream and used by the body for energy, growth, and repair. This process involves several key organs and physiological mechanisms. Ingestion. Food enters the mouth where it is mechanically broken down by chewing and chemically broken down by salivary enzymes such as amylase, which begin the digestion of carbohydrates. Mechanical digestion. In the stomach, food is further broken down by mechanical action, churning, and mixed with gastric juices containing hydrochloric acid and digestive enzymes like pepsin, which begin protein digestion. Chemical digestion and absorption. In the small intestine, food is mixed with bile produced by the liver and pancreatic enzymes lipase amylase proteases to further digest fats, carbohydrates, and proteins. The villi, small finger-like projections in the lining of the small intestine, increase surface area for absorption. Nutrients such as glucose, amino acids, fatty acids, vitamins, and minerals are absorbed into the bloodstream or lymphatic system. Large intestine. Any remaining undigested food enters the large intestine where water and electrolytes are absorbed and the remaining material is formed into feces. The colon also houses beneficial bacteria that help ferment certain indigestible carbohydrates and produce short-chain fatty acids, which provide additional nutrients. Regulation of digestion. The digestive process is regulated by hormones such as gastrin, which stimulates gastric acid secretion, and secretin, which stimulates the pancreas to release bicarbonate. The autonomic nervous system also plays a role in regulating peristalsis, the wave-like movement of food through the digestive tract, and the release of digestive enzymes. By efficiently breaking down food and absorbing nutrients, the digestive system supports overall health and ensures the animal receives the necessary energy and building blocks for survival. What are the key ethical considerations when managing animal health, and how do they relate to animal welfare legislation? Answer: ethical considerations in animal health management revolve around ensuring that animals are treated humanely and their well-being is prioritized. The key principles include minimizing suffering. Animal health management practices should aim to reduce pain and distress. This involves using appropriate medical treatments, providing pain relief when necessary, and ensuring that any procedures or interventions are conducted with the least amount of suffering possible. Informed consent and professional responsibility. Veterinarians must obtain informed consent from animal owners or guardians before administering treatments, ensuring that they fully understand the risks and benefits of any interventions. They also have a professional responsibility to act in the best interests of the animal, even if this conflicts with the desires of the owner. Animal welfare legislation. Animal welfare laws, such as the Animal Welfare Act, establish minimum standards of care for animals under human control. These laws require that animals receive proper nutrition, shelter, veterinary care, and humane treatment. Veterinarians must adhere to these legal requirements when providing care, ensuring that animals' basic needs are met and that they are not subjected to unnecessary harm. End-of-life decisions. Ethical dilemmas often arise when deciding whether to euthanize an animal. The decision should be made based on a careful assessment of the animal's quality of life and whether continued treatment would result in unnecessary suffering. Veterinarians are guided by ethical frameworks and legal standards to make such decisions with compassion and professionalism. Prevention of disease and zoonosis. Ethical care also involves preventing the spread of disease both among animals and between animals and humans. This is particularly relevant for zoonotic diseases, diseases that can be transmitted from animals to humans, where the veterinarian must ensure that preventive measures such as vaccinations and parasite control are implemented to protect both animal and human health. Explain the process of homeostasis and its significance in maintaining the health of animals. Answer: homeostasis is the process by which animals maintain stable internal conditions despite external changes. This is crucial for the proper functioning of cellular processes and overall health. The body regulates various parameters, including temperature, pH, glucose levels, and water balance, to ensure they remain within a narrow range conducive to optimal physiological function. The main components involved in homeostasis include sensors. Receptors throughout the body detect changes in the internal environment, e.g. temperature, blood sugar, and send this information to the control center, e.g. the brain. Control centers. The brain, particularly the hypothalamus, acts as the central control center that processes information from sensors and determines the appropriate response to restore balance. Effectors such as muscles and glands carry out the corrective actions, such as adjusting body temperature through sweating or shivering, or regulating blood sugar by releasing insulin or glucagon. Feedback mechanisms. Homeostasis is maintained through feedback loops, particularly negative feedback, which works to reverse a change. For example, if body temperature rises, the body sweats to cool down, and if it drops, the body shivers to generate heat. Homeostasis is vital because it ensures that physiological processes, such as enzyme activity, metabolism, and cellular function, continue to occur efficiently. Disruptions to homeostasis, such as in cases of extreme temperature or dehydration, can lead to serious health issues and even death. What are the key differences between internal and external parasites, and what are the general approaches to managing each in animals? Answer: internal and external parasites differ in location and method of affecting the host animal. Internal parasites. These include organisms like intestinal worms, roundworms, tapeworms, protozoa, e.g. Giardia and flukes. They live inside the body, typically in the gastrointestinal tract, lungs, or liver. Internal parasites can cause a range of issues from malnutrition to organ damage. Management. Diagnosis. Vets use fecal tests or blood tests to identify the specific type of internal parasite. Treatment. Deworming medications, e.g. anthelmintics, are used to target and kill internal parasites. Prevention. Regular deworming schedules and maintaining proper hygiene in the animal's living environment can help prevent reinfection. External parasites. These include fleas, ticks, and mites, which infest the skin and coat. They can cause itching, skin damage, blood loss, and the transmission of diseases, e.g. Lyme disease from ticks. Management. Diagnosis. External parasites are often identified by visual inspection or through skin scrapings. Treatment. Treatments include topical insecticides, flea collars, and oral medications. Prevention. Regular grooming, environmental control, and preventive medications help reduce the risk of external parasite infestations. Both types of parasites can have severe health implications, and effective management involves regular veterinary care, preventive treatments, and environmental control measures. Describe the major components and functions of the circulatory system in mammals. Answer: the circulatory system in mammals consists of the heart, blood vessels, and a blood. Its primary function is to transport nutrients, oxygen, hormones, and waste products throughout the body. The major components include heart. The heart is a muscular organ that pumps blood throughout the body. It consists of four chambers: two atrial upper chambers and two ventricles, lower chambers. The right side of the heart pumps deoxygenated blood to the lungs for oxygenation, while the left side pumps oxygenated blood to the rest of the body. Blood vessels. Arteries carry oxygenated blood away from the heart, with the aorta being the largest artery. Veins carry deoxygenated blood back to the heart. Capillaries are small vessels where nutrient, gas, and waste exchange occurs between blood and tissues. Blood consists of plasma, the liquid component, red blood cells, which carry oxygen, white blood cells, which fight infections, and platelets, which help blood clot. Circulatory pathways. Systemic circulation transports oxygenated blood from the heart to the body and returns deoxygenated blood to the heart. Pulmonary circulation transports deoxygenated blood from the heart to the lungs for oxygenation. The circulatory system is vital for maintaining homeostasis by ensuring cells receive necessary nutrients and oxygen while waste products are removed efficiently. How does vaccination contribute to disease prevention in animals, and what are the common types of vaccines used in veterinary practice? Answer: vaccination is a crucial tool for disease prevention in animals. It involves administering a weakened or inactivated form of a pathogen, e.g., virus or bacteria, to stimulate the animal's immune system. The immune system responds by producing antibodies and memory cells, which remember the pathogen and can mount a rapid response if the animal encounters the pathogen in the future. Types of vaccines commonly used in veterinary practice include live attenuated vaccines. These contain weakened forms of the pathogen and induce a strong immune response. Examples include the rabies vaccine and canine distemper vaccine. Inactivated, killed vaccines. These contain killed pathogens and are safer for animals with compromised immune systems. Examples include vaccines for parvovirus and certain strains of influenza. Subunit vaccines. These contain pieces of the pathogen, such as proteins, rather than the whole organism. They are often used for diseases like feline leukemia. Recombinant vaccines. These vaccines use genetic engineering to create pathogen proteins that stimulate an immune response. For example, recombinant vaccines are used for the prevention of certain types of equine influenza. Vaccines are critical for controlling infectious diseases, and the appropriate vaccination schedule depends on the species, age, and health of the animal. The success of vaccination programs depends on proper storage, administration, and adherence to recommended vaccination protocols. Explain how the process of metabolism supports an animal's energy requirements and how different types of metabolism are regulated. Answer: metabolism refers to the biochemical processes by which animals convert food into energy and build the molecules necessary for growth, repair, and maintenance of body functions. A metabolism consists of two main processes: catabolism. This is the breakdown of larger molecules, e.g., carbohydrates, fats, proteins, into smaller ones to release energy. The energy produced is used for cellular activities like muscle contraction, nerve transmission, and heat production. Anabolism. This is the synthesis of complex molecules, e.g., proteins, nucleic acids, from simpler ones. Energy from catabolic processes is used in anabolic reactions to support growth, tissue repair, and reproduction. Metabolism is regulated by hormones, e.g., insulin, glucagon, thyroid hormones, and enzymes that catalyze chemical reactions. For example, insulin promotes the uptake of glucose from the bloodstream and its storage as glycogen, while glucagon stimulates the breakdown of glycogen into glucose during periods of low blood sugar. Metabolic efficiency is essential for maintaining an animal's energy balance, and disruptions in metabolism can lead to diseases like obesity, diabetes, or malnutrition. What is the primary difference between the nutritional requirements of herbivores and carnivores? How should these differences influence the formulation of their diet? Answer: herbivores and carnivores have vastly different nutritional needs due to their distinct digestive systems and energy requirements. Herbivores, such as cows, horses, and rabbits, primarily consume plant-based diets. Their digestive systems are adapted for breaking down complex carbohydrates and fibers found in plant materials. This requires diets high in fiber, low in fat, and with sufficient amounts of vitamins, minerals, and water. Key nutrients for herbivores include cellulose-degrading enzymes and specific vitamins like vitamin K. Carnivores like dogs and cats are adapted to consume primarily animal-based proteins and fats. Their digestive systems have a shorter gastrointestinal tract and are designed to digest protein and fat more efficiently, while carbohydrates are less important in their diet. Carnivores require higher amounts of protein, essential amino acids like taurine, and fat-soluble vitamins like vitamin A. The diet must be rich in animal tissues that provide these nutrients. The dietary needs of each species should influence the selection of protein sources, fat content, and carbohydrate levels. For example, a carnivorous animal's diet should prioritize high-quality animal protein sources, whereas a herbivore's diet should consist mainly of fibrous plant matter to promote healthy digestion. Explain how the metabolic pathways of herbivores differ from those of omnivores in the process of nutrient absorption and energy conversion. Answer: herbivores and omnivores have different metabolic pathways to process and absorb nutrients due to their distinct diet compositions. Herbivores rely heavily on the fermentation of plant fibers in their stomachs or cecum. They have specialized enzymes, such as cellulase, that help break down complex carbohydrates like cellulose into simpler sugars, which can be absorbed as energy. For instance, ruminants like cows have a multi-chambered stomach that ferments fiber, producing volatile fatty acids, VFAS, that are absorbed as a primary energy source. Omnivores, on the other hand, have a more versatile metabolism. Their digestive systems are adapted to process both plant and animal matter. Omnivores like humans, pigs, and rats possess digestive enzymes like amylase for starch digestion, proteases for protein digestion, and lipases for fat digestion, which allow them to break down a wide variety of food types. They may process plant carbohydrates via enzymatic digestion in the stomach and intestines, while animal protein and fat are absorbed through more direct enzymatic breakdown in the gut. Metabolically, omnivores are more flexible in utilizing both plant-based and animal-based sources for energy, and their bodies can adapt to different nutrient availabilities. What are the potential consequences of feeding a kitten adult cat food instead of specially formulated kitten food, and what feeding schedules would be appropriate to ensure optimal growth? Answer: feeding a kitten adult cat food can have several negative consequences due to the nutritional imbalance between the two. Kittens require higher amounts of protein, fat, and specific nutrients like calcium and phosphorus to support their rapid growth, immune system development, and bone formation. Adult cat food, on the other hand, is formulated for maintenance rather than growth and is often lower in protein and fat, with different calcium to phosphorus ratios that may lead to bone development issues in kittens. Additionally, the energy content in adult food is typically lower, which could result in stunted growth or underdevelopment if fed to a growing kitten. Lack of essential nutrients such as taurine, an amino acid, and arachidonic acid, a fatty acid, could also cause developmental issues such as heart disease or skin disorders. The feeding schedule for kittens should be frequent, as their small stomachs and high metabolism require regular nourishment. Typically, kittens should be fed 4 meals per day until around 6 months of age, after which the frequency can be reduced to 2-3 meals per day. This ensures consistent nutrient intake to support their growth and development. Mr. Williams has recently adopted a new dog from a shelter. The dog, named Rex, seems to be excessively scratching, pacing, and avoiding human interaction. What behavioral indicators is Mr. Williams noticing, and what might be the cause of Rex's behavior? How should he respond to address these signs of stress? Answer: Mr. Williams is noticing several behavioral indicators of stress and discomfort in Rex, such as excessive scratching, pacing, and avoiding human interaction. These are signs commonly associated with anxiety, stress, or environmental discomfort. The cause of Rex's behavior could be due to several factors, including adjustment to a new environment. Shelter animals often experience high stress due to the transition to a new home. Lack of socialization. Rex may not have been adequately socialized with humans or other animals, leading to fear-based behaviors like avoidance. Medical issues. Excessive scratching could be indicative of a skin condition or allergies, which may be contributing to Rex's discomfort. Separation anxiety. If Rex has a history of being rehomed frequently, he might be experiencing separation anxiety when left alone or when someone new enters his space. Mr. Williams should first rule out any medical causes by taking Rex to a veterinarian for a thorough examination. If the behavior is determined to be anxiety-related, Mr. Williams can begin implementing behavior modification strategies such as desensitization, positive reinforcement, and gradual exposure to stressful situations. Describe the common signs of stress in animals, particularly in companion animals like dogs and cats. How do these signs vary between species, and what are some strategies to reduce stress in these animals? Answer. Stress in companion animals like dogs and cats can manifest through various behavioral and physiological indicators. Common signs of stress in these animals include dogs pacing, drooling, excessive barking, whining, or hiding, as well as destructive behavior like chewing or digging. Some dogs may also show physical signs such as raised fur on the back, piloerection, panting, or trembling. Cats hiding, excessive grooming, vocalization, and changes in appetite. Stress may also manifest as litter box avoidance or overaggression toward other pets or humans. Physically, cats may display dilated pupils, a tucked tail, or a hunched posture when stressed. The specific stress responses can vary between species. Dogs are generally more social and may show outward signs of distress more readily, while cats, being more solitary, may hide their stress but show more subtle signs like grooming or withdrawal. To reduce stress, strategies can include providing a safe space, a quiet, secure area where the animal can retreat when feeling overwhelmed, regular routines, consistent feeding, exercise, and play schedules can help reduce anxiety, behavioral enrichment. Mental stimulation through interactive toys, training, and positive reinforcement can reduce stress by promoting a sense of control and accomplishment. Desensitization and counter-conditioning, gradually exposing the animal to the stressful stimuli in a controlled manner to help them adjust. For example, with a stressed dog, short positive training sessions and gradual exposure to new situations can be highly beneficial. How should animal nutritionists approach the use of dietary supplements for companion animals? Discuss the potential risks of oversupplementation and the importance of consulting with a veterinarian before introducing supplements into an animal's diet. Answer. Dietary supplements for companion animals, such as vitamins, minerals, or joint health aids, can be beneficial when used appropriately. However, oversupplementation can pose significant risks. For example, excessive intake of vitamins like vitamin D can lead to toxicity, resulting in symptoms like vomiting, diarrhea, and organ damage. Similarly, excess calcium in young puppies or kittens can disrupt bone growth and development. An animal nutritionist should approach supplementation with caution, focusing on species-specific needs. Supplements should be tailored to the specific species, breed, and age of the animal to ensure they address any nutritional gaps without causing harm. Consultation with a veterinarian. Before introducing any supplement, it is crucial to consult with a veterinarian to evaluate the animal's current diet and health status. The veterinarian can help determine whether supplementation is needed and which products are appropriate. Balanced diet first. Supplements should never replace a well-balanced, species-appropriate diet. They should be used to complement the diet when there are known deficiencies or health concerns. What are the key principles behind effective enrichment for captive animals, particularly in a zoo or aquarium setting? How can enrichment activities impact animal well-being and behavior? Answer. Effective enrichment for captive animals involves creating an environment that stimulates natural behaviors and promotes physical and mental health. The key principles of effective enrichment include variety, providing a range of stimuli such as toys, puzzles, and changes in the environment to keep the animals engaged. Species-specific needs. Enrichment activities must be designed according to the species' natural behaviors. For example, primates might benefit from problem-solving activities, while felines may enjoy hunting-style enrichment. Engagement of all senses, incorporating a variety of sensory experiences, sight, smell, touch, sound, and taste, into enrichment activities. Behavioral challenges, offering activities that challenge the animal's cognitive abilities and physical skills, such as puzzle feeders or new objects that encourage exploration. Enrichment activities can significantly impact an animal's well-being by reducing stress, preventing behavioral issues such as aggression or stereotypic behaviors like pacing, and improving overall mental stimulation. Discuss the differences in stress responses between prey species and predator species. How does this affect the management and care strategies for these species in captivity? Answer. Prey species, e.g., rabbits, deer, and horses, and predator species, e.g., lions, tigers, and wolves, exhibit distinct stress responses, largely due to their evolutionary adaptations. Prey species are highly sensitive to their environment and exhibit signs of stress when they feel threatened, such as freezing, fleeing, or hiding. These species rely on alertness and quick reactions to evade predators. In captivity, managing stress in prey species requires providing a secure, low-stress environment with plenty of hiding spots and opportunities for natural behaviors such as grazing or exploring. Predator species, on the other hand, are more likely to exhibit aggression or territorial behaviors when stressed. These animals often respond to perceived threats by becoming more confrontational or defensive, and their stress responses may involve vocalizations, pacing, or attempts to escape. Management strategies for predators include providing enough space, opportunities for hunting or stalking behaviors, and addressing any triggers for aggression. In captivity, understanding these differences is key to reducing stress and ensuring proper care for both types of animals. What is the difference between positive reinforcement and negative reinforcement in animal training? Provide examples of each technique in the context of dog training. Answer: positive reinforcement involves adding something rewarding to encourage a behavior. In dog training, this can include giving a treat or praise when the dog performs the desired behavior. For example, giving a dog a treat when it sits on command reinforces the sit behavior, making it more likely the dog will repeat it in the future. Negative reinforcement, on the other hand, involves removing an aversive stimulus to encourage a behavior. For instance, a dog might be trained to stop pulling on a leash by using a head halter that gently guides the dog's head back to the owner's side. When the dog stops pulling, the pressure is relieved, reinforcing the behavior of walking calmly. Both techniques are widely used, but positive reinforcement is generally favored as it is less stressful and more effective over the long term. Negative reinforcement should be used cautiously to avoid causing anxiety or fear in the animal. Mrs. Adams has an elderly cat, Mr. Whiskers, who has developed arthritis and is no longer as active. She is considering adding joint supplements to his diet. What should Mrs. Adams consider before introducing supplements, and what are some potential risks of improper supplementation? Answer: before introducing joint supplements to Mr. Whiskers' diet, Mrs. Adams should consider several factors. Veterinary consultation. Mrs. Adams should consult with a veterinarian to assess Mr. Whiskers' overall health and determine whether joint supplements are necessary. The veterinarian may recommend specific supplements such as glucosamine or chondroitin, which are commonly used to support joint health in aging pets. Correct dosage. Mrs. Adams should ensure that the dosage of any supplement is appropriate for Mr. Whiskers' weight, age, and health status. Oversupplementation of certain vitamins or minerals, such as vitamin D or calcium, can lead to toxicity and organ damage. Interactions with medications. If Mr. Whiskers is taking other medications for his arthritis or other health issues, the veterinarian will need to ensure that the supplements do not interact negatively with those medications. By consulting with the veterinarian and carefully monitoring Mr. Whiskers' response to the supplements, Mrs. Adams can help manage his arthritis effectively without causing harm through improper supplementation.